All right, as people age into their golden years, I think it's just so crucial that when you talk about that doctor-patient relationship, that it really is a relationship. And that is why I'm so happy to be back with the team at Dedicated Senior Medical Center. We are joined today by Dr. Giwala. And let's talk about the team here. Good morning, Doctor. Good to see you.
Good morning. Good to see you, too.
I just love talking with you and the staff here because you can tell how passionate you are about what it is that you do. And again, when it comes to relationships, that patient-doctor relationship, I'd imagine for seniors, this is crucial.
Absolutely. The doctor-patient relationship is absolutely crucial. You're right. It's something that we want to bring back to healthcare. Well, now, what is a doctor-patient relationship, right? It's about spending time with people. The old school way of medicine, right? You want to sit down, square with them, talk to them about where they're from, what they've been through, their medications, what their concerns are about their health, and really finding a way to connect with them so that we can improve their health. And that's really what it's about, making sure that we do everything that we can to help a senior in need.
When you talk about those chronic health conditions too, I'd imagine it's just even that much more important that you're really on the same page, that you're talking frequently. Talk about, how much conversation should be had throughout the year and what that should look like.
Absolutely. I mean, I feel that every senior should have the ability to see their doctor as much as they need to. Here we see our patients all the time. We see them at least every month. That's because we're there for them. We want to spend time with them, find out really what's going on with them, and then get down to the bottom of it and solve it. Not just say, hey, we'll see you later. We want to make sure that we spend time to follow up. And really, we inspect what we expect. And that's what we do here.
Yeah, we were talking about chronic health conditions and then preventative medicine as well. I mean, that's the other key to this. And there's no way to prevent if you're actually not seeing and speaking with your doctor, and honestly with your doctor as well.
Right. Those are two separate buckets. Somebody who has a chronic problem and then somebody who does not have a chronic problem, but we want to prevent that from happening. You do that by seeing them frequently and listening to them and spending time with them. Here we spend about 10 to 12 times more face value with our patients than any other doctor in Tampa. That's because we really, really care about what's going on. And we really want to prevent disease before it happens, not just try to manage it downstream.
What I love, and again, I had to check my notes, you actually give patients, I know a lot of the doctors here, if not all of them, their cell phone numbers. And if there is an emergency or if there is something that needs to be addressed right away, you encourage that.
Right, because it's about access to your doctor. If you have your doctor's cell phone number, you're not going to abuse it. It's about letting them know when you have a problem and then getting them to help you act on it quickly. Yeah. And if we're able to do that, we're really able to improve health for our seniors.
Is there any red flags that you think patients or anyone watching today, how can they look at their current maybe relationship they have with their doctor and say, you know what, maybe I do, it is time to maybe look at somewhere else or somewhere to go.
Right. If they don't feel like they've been listened to, if they don't feel heard, if they don't have the availability and the accessibility to their doctor or their practice, to even one of their partners, that should raise a flag like, hey, how come my concerns aren't being tended to? And sometimes there are things that are going on. Maybe it's a miscommunication, but I would explore that. If I was a patient at a practice and I need to see my doctor and the availability was, maybe 2, 3 weeks, maybe 4 weeks, I would say, is this the right place for me? Because if my problem's here right now, what's going to happen if it doesn't get taken care of? Where am I going to end up? Maybe a hospital, and I don't want that. Most Americans don't want to be stuck in some kind of medical debt, but a lot of Americans do. After they're hospitalized, they get stuck in debt collection, and that's where we need to keep people away from. We need to keep them away from the hospitals, keep them away from the debt, and really focus on keeping them happy, healthy, and
I love that. For people watching at home, what's your take home to really make sure that, this is probably one of the most important health decisions you're going to make is where you're going to find, that general physician. What's your take home for people watching this morning and when they're picking out that doctor?
Make sure you take your time to find someone who's going to listen to you, listen to your concerns, and find a solution. And make sure you have an avenue to always communicate openly with your doctor, whether it be a cell phone number or a sooner follow-up appointment, making sure that we're doing everything that we can to be there for our patients.
Well, again, doctor, this is why I love spending time here and meeting the different doctors at all the different locations across the Bay Area, because you can tell that the team is passionate about what you do. So we appreciate that. Thank you so much for your time,
My pleasure.
Doctor.
My pleasure.
All right, seniors, and we want to let you know this morning. Seniors, you need to call 813-822-3323 this Thursday to have all of your questions regarding Medicare, Medicaid, and prescription assistance answered by, get this, licensed representatives. Again, that number to call this Thursday, 813-822-3323.